Okay. Thanks for sharing, everybody. We are so happy to have Olivia Newcomb here today. She is a NICU nurse at Bay State Medical Center in Massachusetts. She has a lot of experience working with babies born with an omphalocele, and she's going to be sharing her insight about caring for O babies with all of us today. Before she begins, I want to remind everybody that even though Olivia is a nurse, she is not your nurse, and she is not providing any direct medical advice today. She's here to share her personal experience with all of us, so please direct any medical questions to your own providers. All right, Olivia, I will let you get us started.
All right, thank you. Can everyone hear me okay? All right, well, first I have to say, I mean, I'm sure you guys have mixed feelings, but I'm so excited. So many new O babies coming along this summer and fall. So my name's Olivia. I've been a NICU nurse for a little over 5 years, and I've been in the NICU the entire time. I'm here today because I love omphalocele babies, and as Christina mentioned, I was Elliot's nurse when he was in the NICU. Uh, I don't know what it is. I've just always gravitated to them. The second I met my first O baby, ever since then, when they pop into the NICU, I'm there and I don't leave until they leave. Um, we do joke at work a lot that omphalocele babies, they tend to have the cutest faces and the sweetest dispositions. They know that something kind of went crosswire along the way and they make up for it by just being the most lovable, beautiful babies. So I'm just all really excited that you're about to just meet your beautiful new child or grandchild. I've worked with probably at least six O babies, which probably doesn't seem like a lot, but they don't actually pop up as often as you think. That being said, it's still oddly common. It's definitely an interesting thing. I've also worked with a lot of other what we call belly babies at work, which are just other babies with gut issues, and they all kind of follow the same path. Um, so I do just want to reiterate, I am just a nurse. Well, not just a nurse, but I am a nurse. Every omphalocele baby is different, and every NICU is different. So you may have a completely different experience. So I just want to prepare you for that. Also, what I'm going to talk about, I'm really just going to go surface level on, but if you have any other questions, definitely feel free to reach out and I'm happy to talk more. So the majority of omphalocele babies that come to our NICU, they often need respiratory support to begin with. Usually they can wean off of that fairly quickly within a couple of days. Uh, but that's generally the first thing that brings them to the NICU emergently. And then we tend to transition more into, okay, we've got this omphalocele and we need to get this baby eating. Um, so I'm sure you've Googled and you know more about this, but when a baby's born with an omphalocele, it is encased, but it's not entirely covered with skin. So a huge portion of what is done in the NICU is wrapping that omphalocele to kind of keep it protected as it epithelializes, which is just growing skin over it. At my NICU, we tend to put either bacitracin or a Vaseline gauze, which is essentially just a gauze soaked in Vaseline. And then we wrap gauze all the way around the baby so that they're wearing it almost like a belt. And it's kept loosely on. We change ours at least daily. You will notice sometimes in the early days, they kind of ooze, or they actually can sometimes bleed a little bit from where the belly button is because that has to scab. But it's not actually as gross as you might think. It's kind of funky. It's kind of cool. Sometimes you can even like see almost what's in there. Telling you, I don't know what it is. I think they're fabulous. But we do keep them wrapped. It doesn't get irritated if the baby's going to wear clothes or get wrapped up in a blanket. Um, and then it's unwrapped every single day so that we can keep an eye on it. And as providers, nurses, parents, and then at our hospital, the surgical team is very involved daily. We always want to assess and see what's our omphalocele doing? Is the skin growing over it? Sometimes they shrink down a little bit as the baby is out and doesn't have as much pressure from the uterus and all the fluid. So you just never know. At our hospital, we do work with parents to teach you how to do the wrap, because you are generally going to go home with the baby still wrapped up. And it's fairly simple. And it's something that you could practice hands on with a provider, with a nurse, so that you are comfortable doing it. I know one of the questions was about compression wraps. And we've never started that at the hospital that I'm at. That tends to be something that's done once a baby is home and the omphalocele has settled more. Um, but that's something that you would keep in contact with your surgical team about. And at my hospital, you do leave the NICU with a follow-up appointment with our surgical team. So you're definitely connected the whole time, and you're not just sort of discharged and then suddenly kind of floating in the abyss. So you'll know what you need to be doing as far as that wrap. Um, so when omphalocele babies are born, sometimes they need the respiratory support, but often they come to the NICU just because we need to see what's up with their bellies. Generally, once a baby is stable, they could be held. So I know a big concern of parents is, when can we hold our baby? Depending on how stable that baby is, sometimes you can hold them within an hour or two after birth. I've never seen an omphalocele be the reason a baby cannot be held by their parents. And so it's important, as long as, if you have a nurse that's saying, oh, this baby's great, his oxygen's fine, everything looks great, we're just going to monitor the omphalocele, then can I please hold? Because I think it's super important that baby gets with mom and dad immediately, because you got to start bonding right away. Mainly it's going to be respiratory distress that's going to delay that hold, but I think you'll find that you'll be holding your baby a lot sooner than you think. The biggest issue that we come across with O babies is eating. We don't always know exactly what's inside the omphalocele as far as intestines and organs. It's just sometimes a mystery. And anytime the gut has been manipulated, it makes feeding and digesting harder for a baby. So I do think that the biggest thing that keeps an omphalocele baby in the NICU is struggling to eat and digest milk. We see problems with reflux, vomiting, diarrhea. It's just we have to learn what's going to work to get the milk to go from A all the way to Z, so that baby's also getting appropriate nutrients and gaining weight so that they're safe to go home. Generally, we do start feeding with a nasogastric tube, it's a teeny tiny tube that goes from their nose to their belly, and we can put feeds in there. But if you're giving birth to a full-term baby, there's no reason that you can't start feeding them with a bottle or even breastfeeding them. In the NICU, we're very numbers based, so sometimes we're hesitant to start breastfeeding because we want to know how much the baby's taking in. But there's absolutely no reason that you will not be able to breastfeed your O baby if that's what's in your plan. Sometimes the position might just be different depending on the size of the omphalocele. But another thing to remember is that as that omphalocele epithelializes, it's not a wound. It's not sensitive. You're not going to hurt the baby by holding them on your lap to breastfeed. So I think, don't let that hinder you if that's a choice that you really want to make and do, because we want all babies fed. We want them all healthy. But if you want to feed your milk, then go for it. In my NICU, we always start with mom's milk. Sometimes we do add fortifications, because if they're having trouble digesting, which means they can't take as much volume as they need, that means they might need more calories or more nutrients in that smaller volume. So sometimes we do add fortifications, or we might have to supplement with a formula. And then sometimes you have to change the kind of formula you're using. It's just like I said, anytime you've had some kind of change in that gut, it becomes super sensitive, and we have to kind of follow along to see what is baby tolerating and how can we get them to where they're going to be taking what they need to take to gain weight and grow so that they can go home safely. Um, as far as discharge for babies, all NICU babies, all babies in general, they all need to be breathing on their own, maintaining their own temperature, and eating everything by mouth. So discharge from omphalocele babies is going to follow that same path. It's going to work in conjunction with our surgical team to make sure that omphalocele is ready to go home. And it's going to make everyone needs to make sure that moms, dads, whoever is comfortable taking this omphalocele home, because you are going to have to change that wrap every day at least. Or if it gets wet, sometimes babies pee on them. You never know. I've seen babies throw up on them. It's always a surprise. So you just have to be comfortable. But it honestly, I think it'll become second nature. It's kind of almost like changing a diaper, but dare I say, better. Doesn't smell, so that's a bonus. Um, so we just want parents to be hands-on. In the end, we always say, this is your baby, you're taking them home. So you have to know what you're going to do at home, and you have to feel safe going home that way. Because every single omphalocele is a different shape, a different size, it's even sometimes they're on different parts of the belly. This car seat question, I've actually been doing research on the car seats myself. I have actually never seen a baby with an O go home in a specialized car seat. More often than not, they manage to fit in the regular car seat. I know my NICU has car beds we can put a baby in, which is a safe car seat, but the baby lays flat. And the buckles are a little bit different. So that could be a use. I wish I could tell you more. What I want to say is, if you have a question like that, ask early and ask often, because you know that baby's going to have to go home and you want them to get home safely. So if you're going to need one of these specialized car seats, which I've heard can be really a pain in the butt to order and get to you on time, then don't hesitate to reach out early on. Like, we're talking days after birth. You could say, do you think my baby's going to need this car seat? Because then I'm going to need to look into it. And feel free to ask the nurse. And if the nurse doesn't know, ask them to escalate to the provider or the surgical team to help you figure that out. As far as being a parent in the NICU, just never forget that this is your baby, okay? Sometimes it's going to feel very overwhelming and you might feel a little disconnected, but you are this baby's parents, you're this baby's grandparents, you are going to know them best. Your gut feeling of, I don't know, that doesn't seem right, you're probably right. So don't hesitate to speak up, to advocate for your baby, because in the end, you're going to know what they need and you're going to know what your family needs to go home. As long as your baby is stable, you should be able to hold them and snuggle them and feed them. As a matter of fact, we love that. We want you in there doing that. Who, as far as me doing my job, who doesn't? I would love to say, yeah, mom and dad, please feed this baby. I'm going to go chart. I've got plenty of charting to do. You can feed and snuggle. Our NICU, we allow 24-hour visitation for parents. And so that's, I think, important. Everybody has a different schedule. You're going to find what works for you if you have a longer NICU stay. Babies will be okay if you go home. That's another important thing I wasn't going to say. But you know what? If you go home to take a hot shower and lay in your own bed, your baby's going to be okay. We'll snuggle them. I promise. If I were there, I'd be snuggling them. Our NICUs generally provide everything this baby could possibly need: bedding, bottles, clothes, diapers. But I think that you should feel free to bring in blankets and clothing of your own as long as they're washed and clean. In our facility, as long as your baby does not have a central line, we allow them to be dressed and wrapped in blankets from home. And that is a huge step to make your baby feel more personalized and a little bit less like a sterile hospital. And honestly, that first time you dress them in an outfit from home is just unlike anything else, because suddenly you're going to see them in something you bought and you're going to go, oh, that is my beautiful baby. It doesn't matter that we have this long road ahead of us. You're going to look at their sweet little face and realize that they're just absolute perfection, because they are. They totally are. Um, the last thing I want to say is that if you have a question, ask it. There is truly no such thing as a stupid question in the NICU. This is a brand new experience for every single parent or family member that comes in through the doors. Even if you've had a prior NICU baby, I can guarantee you this experience will be different, because, like I said, every single baby, every single omphalocele, they're all different. So please remember, it it doesn't matter what the question is. I mean, even as a nurse, I've asked some silly questions before, but sometimes you just need to bounce them off of somebody. And in the end, if you get the answers to those questions, you're going to be armed so well to bring this baby home and to continue to be their best advocate. And that's what's really important. I mean, there's a chance it could be a long road. We do see a lot of these kids where we struggle to wean their IV fluids as we get their milk tolerance up. And that can be incredibly, incredibly frustrating for both the parents and the nurse. I know I've been there before. A certain baby who we may have seen this afternoon briefly, who would just throw up on my lap in the middle of the night. And that's so frustrating, because you're thinking, oh, he's doing so great. He's gaining weight. He's going home. And then bam, suddenly you're covered in vomit and you're like, oh no, we were so close. So you can commiserate over these things. We're all kind of frustrated because all of us have the same goal. We want your baby healthy and home with you to face the future of what comes next, because a healthy, happy baby is going to repair so much easier down the road. So please, if you have any other questions, I know I glossed over a lot of the medical-y type things. I think as far as parents, your role is just being parents. It's going to be really hard to learn all this medical jargon when you first arrive, but um, I think just remember that it's going to be a ride, it's going to be a challenge, but you're going to come out the other end and you're going to be your happy, perfect family.